And first, let's recognize for the PFA, that means pulse field application. Um, the PFA has been used extensively in other medical fields, including oncology and drug delivery. The pulse field ablation (PFA) is a process where applied electric field resulting in the formation of pores in cell membranes with a subsequent increase in cell permeability. And the creation of pores lead to an imbalance within the cell. 这个翻译能看懂吗？学者基本上可以是吧？我简单说一下吧。Sorry, because so many audiences Chinese audience, so I just say a short introduction about this content, OK？也就是说，这个 PFA 这个新能源呢，大家最近很热门，它主要是一个电穿孔电穿孔这个过程，实际上不仅仅是在心脏里边，在其他的领域，包括药物，包括我们这个肿瘤学等等很多领域，实际上就涉及到这个能源。The mechanisms of electroporation, and let's see such as figures. We can see the electroporation has a gradual effect that range from transient reversible change to irreversible apoptotic death. Just depend on the electric field, the pore. And low intensive electric field causes reversible transient pore formation. We call this RE, reversible electroporation, which allows drugs or gene delivery but does not comprehensive cell viability. But here, strength electric field cause dramatic change in membrane's permeability, which lead to cell death. We call IRE. Just like the figure shows, we can find depending on the electric field strength and also with the duration, if it is longer, and they can cause the cell reversible electroporation and irreversible electroporation. And if the sole pore for the electric field, they can call the thermal effect. And when we see the mechanism of IRE, we should know if the energy is above the threshold, they can cause invisible electroporation. They can cause tissue-specific injury, scar penetration, but it's less causes collateral damage, and it can also cause the during lesion. 也就是说，这种电穿孔的话，它有一些优势，就是对这个相邻的脏器的损伤比较小。另外，它这个能够快速释放，然后这个损伤呢又比较持久。另外它有很多的这个组织选择性，所以的话，接下来我们再讲这个就有关这个心律失常、肾病消融，在房颤的话，它会对心肌有选择，但是对周边的这个组织呢，可能损伤就比较小。So let's see the parameters of PFA. The cell effects observed depend on the application field, which is determined by pulse duration, voltage, frequency, and polarity. The optimal parameters are not uniform and are different with each system and individual case design. 那就是说，我们这个 PFA 的参数呢，实际上受很多的影响，也就是说 PFA 的效果呢，实际上受很多的影响。就像这个图示中间的，比如我们的脉冲的时间，包括我们这个脉冲的次数，以及我们这个脉冲的频率，包括脉冲的这个波形的形态，等等。那么不同的厂家、不同的这个导管设计呢，可能会产生不同的这个结果。And till now, so many the preclinical study of IRE is issued. We can see in tables. Most of them proved that with the IRE, the tissues can be completely damaged, and this is a preclinical study. 也就是说，动物实验显示这个IRE 呢比较有效，同时呢它的安全性呢是比较有保证的。Now the current catheters and clinical evaluation for IRE, just like the Boston Stanfic and Medtronic and also Bell's and Weber's, such companies issue the different design for the IRE catheter。那就是目前我们市面上看到的有很多，包括我们国产的也有很多的 IRE 的这种导管，像这个波科的，以及美敦力的，以及强生的等等，设计不一样，但是它的能源呢都是这个脉冲。And also, so many ongoing pulsed-field application trials was registered on this website. We call it pulsed AF, Admire, shared per AF, and also Advantage AF。那么现在也有一些正在进行中间的临床实验，也就是关于这脉冲的，包括我们国产的也有很多的厂家在做。那么这些可能对我们对脉冲这个导管的认识呢，可能有更多的帮助。So from the last slide, we can know that the PFA has a tissue selectivity. And typically, the tissue has distant electrophoresis threshold. So by the PFA, when electrofield is applied, electroporation will only occur if the magnitude of the field is large enough above its threshold. Just like this figure shows. 也就是说 PFA 为什么有组织选择性呢？是因为它这个不同组织对这个脉冲场，就是我们电场这个阈值是不一样的，只有超出了这个阈值，它才能产生这个不可逆的这种电损伤。所以呢，我们看到这里边列出来有神经啊，包括循环系统，包括我们肾脏等等不同脏器，它都有不同的阈值，所以这话它会能发挥这种组织选择性的特点。Next, let's talk about the safety of PFA. From the animals trial, we can find that the IRE produce dural effects on myocardial cells with many effects on the adjacent structure, such as esophagus, radic nerves, and do not cause PFA stenosis. 也就是说，这个我们刚才讲的，它这个因为有组织选择性，所以它所有的心肌，包括我们看这肺静脉里边，上面这个是我们这个射频能量，下边是脉冲能量。我们看到这个消融完以后，这个组织，我们看到它这个没有发生这个肺静脉狭窄，而且呢对相邻的，你比如说膈神经包括食管相邻的组织呢，我们看组织切片上没有造成损伤，但是这个射频呢，很多时候会造成相邻的。因为它是个热损伤嘛，会造成相邻的这个器官会发生一些这种损伤，甚至导致食管穿孔等等这样情况。And next, let's see the complications in the clinical trials issued recently from 2018 to 2022. So many authors observed for the PFA in the atrial fibrillation, for the ablation for the atrial fibrillation, and but for the complications, almost all of them did not find the IRE-related adverse events. 就是说，从目前公布的这些有关 PFA 的临床实验中间，我们看到，很少出现有这个就是脉冲相关的这种不良反应的情况存在。很多的时候呢，是跟着我们的导管操作，比如心包填塞呀，或者是心包这个积液啊等等，包括穿刺部位的血肿等等，这样和这个 这个脉冲没有直接的关系啊，也就证明它的安全性。Next, let's review some of the clinical trial about the RFA. The first one is Manifest. We all know it's the first study of the method acute effective and safety of the first clinical approved PFA catheter to treat atrial fibrillation. In these trials, no esophagus complication was found, and also no radic nerve injury was occurred. It reported for the major complications is cardiac tamponade and stroke, but it is very low. And for the acute PVI, in almost all the patients can achieve this endpoint. But the frequency of genetic catheter complication, for example, tamponade and stroke, underscores the need for improvement for the catheter. 也就是说，我们先看看这个国际上公布的第一个就是 Manifest 这个研究，这个脉冲消融这个 首先讲的，这是第一个我们文献可以查到的有关的脉冲效应的临床实验。那么在这个实验中间呢，它这个安全性是非常高的，就是没有食道的这种并发症，包括膈神经的并发症都没有。那么主要并发症呢，都是比如说，你看我们看着这个心包的问题，还有这个卒中，和这个脉冲呢没有直接的关系，就是导管这个。那么即刻的这种非静脉隔离症呢，几乎达到100%。那么但是呢，这个中间出现的这种有关导管相关的这种并发症呢，确实可以引起我们重视，也就是说，可能它这个导管器械系统可能需要进一步的进行改进。The next trial is a PARS AF pivotal trial. It's a prospective global multi-center and non-randomized paired single arm study. And in this study is include for the paroxysmal atrial fibrillation and persistent atrial fibrillation. Each group is included for 150. All patients were monitored for 1 year using weekly and systematic transient telephone monitoring in the 3, 6, and 12 months for the ECG monitoring, and for 6 and 12 months for the Holter monitoring. And in this trial, it has shown that the PFA is effective at 1 year in 66 patients with persistent paroxysmal atrial fibrillation, and 55% atrial fibrillation was effective. 也就是说，在第二个临床实验中间的话 ，OK. So for the third clinical trial, we can it's a multi-center INSPIRE the study. It's issued by the Johnson Johnson company. It's a prospective multi-center single-arm study, and across 13 centers in Europe and Canada. 200 subjects were enrolled, and after this procedure, novel the loop biopsy PFA catheter with a sandy mapping system was used. The total procedure time is 80 minutes, and from these trials, we can find that the freedom from symptom atrial fibrillation recurrence at 1 year was nearly 80%. And also, we conduct for the PFA of atrial fibrillation in our center. Till now, we had completed for 25 cases. That's the data of this patient. One of them is 50 years old. 64 is male patient, and their left atrium is not so large. It's 36 millimeter, and don't combine so many computations. And for the procedure, the operation in left atrium is 45 minutes, and ablation time nearly 30 minutes. X-ray duration is 360 seconds. Ablation attempts for each patient average is 65. That's our workflow of the varipulse ablation for the PVI. First is include a thromby of the left atrium appendage with ice. The second one is we do the transeptal puncture guided by the ice. Second, we use the pantry catheter, do the FAM geometry, and then we do the varipulse application for each pulmonary vein. After this, we check for the PVI by the subtract mapping, use the pantry, and the last one we do the induction and the CVT check for the vagus nervous stimulation. And this just from the video we can show how we do this procedure. That's what we do the left side superior pulmonary vein for the catheter position, and because the catheter, the diameter is larger for the paroxysmal atrial fibrillation. So when we do this one, we should narrow this diameter, and just like this one, and by this support for the vesical catheter. And this is right pulmonary vein. Okay. And after this introduction, such question we should know and we should face for the clinical the doctors. The first one is a single application of PFA is sufficient to cause transmural lesion, and we know that unlike the radiofrequency application, PFA is inhibited repeated dependence as lesion dimensions increase with consecutive application at a similar electric field. And but the mechanism is unknown for now. Some studies have shown that repeated application are required to push the depth of the lesion to its maximum, just like the picture shows. So when they do this one, we should do maybe 2 or 3 times for the PFA ablation for each pulmonary vein. And next one is the immediate loss of PV potential is clinical endpoint, but for the PFA it's not. Just like this show, when we do the PFA ablation, we can find the PV potential loss just at the first attempt. Because PV potential reduction can occur with initial energy delivery. Therapeutic energy field can strain the tissue and cause electrogram to disappear. When we do the remapping study, has showed that electrode activate to previous electrode silence area. So we should do this more for each PV for the PFA application. The last question is the PFA ablation does not require tissue contact. For now, all the PFA catheter do not contain for the contact force is index, but we know that the pulse field strength is greatest near the electrode. The electrode tissue contact prevent electrode current leakage to surrounding tissue, and the lesion depth and width increase significantly as electrodes are moved closer to tissue. Lesion depth increase significantly with increasing contact force. So if the contact force is good, so for the lesion depth and width is good also for this attempt. Electrode tissue contact is required for effective lesion formation with PFA application. So I know that for the next generation for the PFA catheter, the catheter may be contained for some sensors to contain the contact force, this one. And also for the PFA is a combined non-thermal energy. So the answer is no. We see this picture, we know that depending on the electrical field, the power of this one, if it is so large, it can cause the thermal injury. So time limit, let's summary for the PFA of this fibrillation. For this energy, they have the pores and the pit fields of PFA. For the pores and for the good side, it's invisible electroporation, and this is tissue sensitive, and also promise preserve tissue compliance. Sorry. And also for the efficacy and safety, it can cause deep and transmural lesions and durable lesions, and also spare adjacent tissues, no PV stenosis, no esophageal lesions, no tissue collagen, and so on. And also current literatures shows that excellent limited data mainly from observed study for the PFA, but not for the randomized clinical trial. And for the pitfall, shortcome for this PFA is it's several mechanisms not entirely understood. For the mechanism is something we can know for now. And also for the efficacy, for the PFA, the dose is dependent by different individuals, and for the optimal dose is unclear also. And also for the future study for the PFA, it's expected superior safety profile compared to standard of care technologies. And a novel PFA system provides a unique opportunity to treat atrial and ventricular arrhythmia. And tailoring PFA for different target lesion depths is suggested. Thank you for your attention.